Hello everyone, I am Dr. Yatin Sagvekar, consultant neurologist. On this occasion of World Stroke Day, I would like to share with you all simple do's and don'ts and certain facts about acute stroke. Acute stroke is a medical emergency which happens due to damage to any part of the brain due to lack of blood supply, either due to a blockage to this blood supply to the brain or due to bursting of the blood vessel supplying the brain. Stroke is one of the leading causes of disabilities in our country, and most of these strokes are preventable, and a point of utmost importance is that majority of the disability is preventable if treatment is administered early. So how to spot someone having an acute stroke? The common signs of acute stroke are easy to remember with an acronym like B FAST, that is BEFAST, and it is the most meaningful one as well, as we have to be fast. Here B stands for if someone is having any sudden balance issues, imbalance or fall. E stands for if there is any sudden eye problems, that is loss of vision, blurring of vision or double vision. F stands for if there is any sudden facial deviation or facial asymmetry, especially found when asking the patient to smile. A stands for if there is any sudden arm weakness or numbness, could be either hand or leg weakness or numbness or one side of the body. S stands for if there is any sudden speaking difficulty, inability to speak or slurring of speech. And T here does not stand for any symptom but is of utmost importance because T stands for time, and time is of essence. Time is brain. Every single minute that is lost in administering treatment in acute stroke, there is loss of around 18 to 20 lakh of neurons per minute. So you have to be fast and take the patient to the nearest stroke ready hospital. A stroke ready hospital is the one which will have a CT scan functional 24 hours a day. If the patient reaches within a particular window of time period, then a stronger blood thinner called clot buster can be administered, or an angiography can be done to suck out the clot. Both of these procedures, however, can be done only if the patient meets certain clinical criteria, but for that the patient has to reach the hospital within stipulated time period. The important don'ts are that if you find someone having stroke and the patient is extremely drowsy, do not give any sugar water, any food or any medicines via the mouth. If the patient's BP is found to be very high, do not administer double or triple dosages of antihypertensives. If the sugar is found to be low, administer sugar, but do not just wait there, take the patient to the hospital. If the symptoms are seen in the middle of the night, do not think that the patient is sleepy or tired and let the patient sleep and we'll see what is there to be done in the morning. No, take the patient to the hospital. If the patient is found to have any seizure at that time, do not put anything inside the mouth or cut an onion and put it on the nose. These things will block the airways. Patient has to be taken immediately to the nearest hospital. And especially in this ongoing pandemic of COVID-19, we have to be more vigilant because COVID-19 itself increases the thrombogenicity of the blood and increases the risk of stroke in those already having risk factors. In fact, 3 to 5% of the COVID-19 patients can present just with an acute stroke without any other respiratory symptoms. So I would urge you all to be more vigilant, be fast, and take the patient to the nearest stroke ready hospital so that the treatment can be administered early and we can prevent any further disability and further socio-economic burden on our society. Thank you.